Following a natural birth, you may feel a little bit scared when it comes time to go to the toilet. Most women post-natural birth don't want to say anything, but they fear that first poo because sometimes the stitches are very close, they're a little bit swollen, and it's tender down below. But when they go to the loo, they hold back. That is the worst thing you can do. You need to go to the toilet when you get that urge. Take your spray bottle, spray, perhaps sit in the bath, run yourself a nice bath, and as soon as you've been to the loo, instead of wiping the area, you can always just step into the bath. That way it will help things to heal beautifully. You want to keep the area clean, and you absolutely don't want to be straining when you go to the toilet, because having a poo when you're constipated and you've had a natural birth can cause the stitches to tear. It can also cause a lot of discomfort and have you coming back into hospital will not be a good idea. So we want to prevent that. If you get the urge to go to the loo, please go. If you can ask your doctor to write up a stool softener in case you are a bit worried or a bit tender down below, please do that. If you're suffering from hemorrhoids, they may be quite painful post-birth because of all the pushing. You would then need to ask for a cream that can just localize that area and help with the inflammation. If you've had a Caesar, it's surgery that's very close to the bowel. When you're given the spinal anesthetic, in order for them to do the surgery, your peristaltic movement of the bowel is now paralyzed. So instead of the bowel moving the food down, it sits still. And any food can sit there, can get a sluggish bowel. It's easy for moms to get constipated, which is one of the reasons you shouldn't go home from hospital until you've had a bowel action. And you probably will be asked this, so just prepare to be asked about your bowels. Again, ask for a stool softener, no straining, and if you are experiencing pain, down below, when you go to the loo, you need to consult with your doctor. There are some conditions like hemorrhoids that have closed off or not a very good blood supply. You need to make sure that you see your doctor. Don't be shy. Up to 80% of women suffer from hemorrhoids post-birth. And many of the time, those hemorrhoids will go away a couple of weeks afterwards. It's simply from the pushing and the pressure.